From the garage that sparked the global self-care movement, welcome to the Human Garage Experience, a podcast where we have unfiltered conversations on self-healing, consciousness, and optimizing your life with fascinating individuals changing the status quo. I'm your host, Garry Lineham, and I'm honored to have you here. Let's get down to it. Today I'm talking with Alla Ozerova, and we're talking about the core elements of disease and dysfunction. Every disease, every dysfunction boils down to two emotions that you have in your body. We're going to be talking about this in depth, and we're going to be talking about the field, fascia, science, engineering, and how society regulates shame and guilt and how these affect you dramatically. This is a powerful episode. You get to meet the person that I talk to all the time and the one that helps me balance my thoughts about how human care and human development works. This is a powerful episode. Stay tuned.
I'm Alla Ozerova. I'm the head of Canada for Sujok therapy, #1 practitioner, master, doctor of Chinese medicine, but don't call me doctor. You'll find out why.
Where does all disease come from?
Disbalance in the field.
What does that mean?
Energetic disbalance. Well, we're all energy, right? So certain life events and traumas program your field to vibrate on a certain frequency that will affect the body in a certain way. Okay.
For somebody who is grown up in the system of medicine and science and hormones and glands and...
Yeah, they don't know.
Yeah, so... For someone who's grown up in this scientific world, what does that mean?
Well, that scientific world has yet to provide explanation to disease from their scientific point of view. So they cannot even argue with my understanding of what disease is, right? Because they don't have explanation to it. I have an explanation. I'm telling you that energetic disbalance is causing energetic disbalance within organ or a tissue or functionality of a human body. And most definitely energetic disbalance is coming predominantly from certain life traumas and events. So we have 6 elements, energetic elements that control everything in our body. Human is actually very, very simple. So we have the 6 elements, and under those 6 elements, we can classify any organ, any functionality of the body, tissue, layer of the body, behavioral traits, personality of a human, emotions. So if one of the 6 elements or 2 or 3 of the 6 elements are in disbalance, tug of war, one is trying to dominate the other, one is in deficiency, another one is in excess, you can actually imagine the list of the diseases that come forward on a physiological level.
So where, in your opinion...
And then, sorry for interrupting you. So yeah, so we have, and then usually 99.9% of the time, energetic disbalance is coming from disruption in emotional flow, right? So we have exuberance of worry, we have that element is too much of it, and then we have the organs assigned to it, which is digestive system, adipose tissue, our endocrine system, long list that is firing off and showing up on a physical level. And then opposing element that is responsible to clearing up is trying to invigorate itself, trying to rebalance the initial element that's out of balance, and then we have another list of things that is going out of whack. So that's just liver, neuropathy, irritability.
So making it simple, like if we were talking to a 5-year-old.
5-year-olds would probably get it better than adults.
They probably would.
Yeah.
So what would you say is the root cause of all of these dysfunctions?
Emotional disbalance.
And what are the emotions that, as a clinical practitioner, you treat tens of thousands of people.
Yes.
And what are the emotions at the core of it that cause all this dysfunction?
Worry, stress, sadness, fear, shame, and guilt. Well, actually, in Sujok, in my craft, I can access any emotion for the human being. I can boost it or I can reduce it. So I have a nice map of those emotions.
Thanks for watching and tuning in. These conversations have radically shifted my life, and I want you to experience those radical shifts too. Take these conversations and integrate them into your body by joining one of our fascial maneuver reset programs. Introduction to fascial maneuvers, 7-day reset or 28-day reset. We're going to put the links below. Take that cerebral knowledge and that experience that you're having right now and bring it into your life by resetting it in your body. These programs have radically shifted my life, and I know they'll radically shift yours. Don't wait another moment. Reset your life today.
So,
and when you say boost it and reduce it, I want people to hear this, because if somebody comes in and they're sad,
I can reduce the sadness.
You actually physically reduce the sadness
With
so that they can
immediate-
perceive another way.
Yes.
And I've watched you do this, sadness or anger or shame or guilt.
Upgrade. What happens is you don't just reduce the emotion. You actually trying to take the patient from point A to B, where they upgrade their consciousness and they understand what had caused that emotion. Not just understanding the event, actually taking themselves out of the victim mentality and putting themselves in a position where I understand where it's coming from and accept it. And I know how to deal. I will be dealing with it instead of just looping in this. I am sad. I am depressed. Coming into my treatment with the label put by Western doctor, you have anxiety, depression, and then they walk around with this label of the diagnosis. So you explain it more in terms like it's an energetic disbalance that your body perceives in such and such a way. That we can put you back in balance. We can upgrade your consciousness that you actually prevent looping in the same programming, going to the same disbalance. The programming happens in the childhood, right? So it's most usually, I go straight into the childhood. Volatile household, the kid is coming home not knowing it's going to be war or peace. Did the dad slam the door too heavy? Is the mom actually didn't cook the dinner today? So they become hypervigilant. Hypervigilance, training the little kid to be reading the external environment 24/7. Yes, they are more observant. In the future, when they're adult, perhaps they're more efficient and successful in their careers because they're constantly scanning the environment with what it creates on the internal. In their mind, in their head, it's a circus du soleil. It's a constant loop of thinking, analyzing, overthinking. And then we have one element is an exuberance right there from childhood. And so we have that disbalance. But if you are internally already have the programming to vibrate on a certain level, the universe, the life, is gonna has no choice. It has no choice but present you with the same examples of the same energetic disbalance, maybe different scenarios. But if you dilute that scenario and what is the energy behind it, what is the emotion behind it, it's going to be the same one 99% of the time, the one that was introduced in the kids' field from the childhood.
Are we all having disease based upon something that happened in our childhood?
Predominantly. Sometimes, very seldomly I have a patient coming in and they're like, I have a beautiful childhood and everything was great. I'm like, well, you're my unicorn. But we're all given, I call it a pie of pain at some point of our life. It doesn't make it okay that you have your pie of pain, I have my pie of pain. It's not okay. I wish you didn't have that pie of pain. I wish I didn't have mine, but I accept it. This is what happened to me. And acceptance already instead of, again, it's very important to go from the victim mentality into I can do something about it. I want to say winner mentality, but person who's responsible for themselves, and then taking responsibility for who you are and what is happening.
Does anybody ever come in and say, I had a great childhood?
Yes, I call them unicorns.
Yeah, and when you dig down underneath the covers, there's still a dysfunction though.
Because the dysfunction was introduced later on at some point of life. It's like a rite of passage, I believe, for any human being. It's a necessary part of becoming human. You are given a certain level of dysfunction at some point of your life, and it's up to you to overcome it and learn from it. Or you're going to keep on looping and looping.
Dealing with. Let's take a look at this. And the reason I'm asking these questions is to set up a framework of this conversation. Mm-hmm. Because what you've already said already flies in the face of most medicine. Most medicine believes that our body has something either right or wrong with it, and it's biological, it's hormonal, it's glandular. And for me, in my practice, I found none of that to be true. I found what you said to be true, which is I have an emotion that I'm not dealing with, and it causes a certain set of behaviors and fears. And the stronger I energize that fear, the more I attract stuff in this world to magnetize that, and then that just shows up in my body.
Correct. Western medicine is looking at the symptom and putting a label on it, aka diagnosis, and call it a day. They think they did their job, right? And then that patient comes in here to the practitioners like me or you or someone else with no answers, no solution. I treat really difficult cases. So usually if someone comes in to see me, they have tried everything. They pretty much develop PTSD towards a person in a lab coat. I am more and more facing the challenge that I almost lose credibility in my ability to heal a human sitting in front of me just because I do have a DR in front of my name, which I ask people, do not call me a doctor, and I have a lab coat on my shoulders. Sometimes I even, like if I see a person has been down that rabbit hole with no solution, no help, no answers for anything, and they're coming in and they're like, I've seen this specialist and this is the star of their field, and they give me this diagnosis and that diagnosis. I'm like, I don't care. They're like, what do you mean you don't care? I'm like, I don't care what they told you. I just want to know your symptoms. Tell me how you feel. They're like, oh, it's hormonal disbalance. I'm like, no, but we're going to figure out actually what caused that disbalance. Everyone is capping out on the symptom. They're not looking beneath it.
What's causing the symptom?
What caused the symptom?
And so almost all medicine, even naturopathic and Eastern medicine now, is being practiced in a symptomatic fashion. Mm-hmm. And part of the reason why society keeps looping in these loops is because we're constantly treating the symptom and we're never
Everybody's trained that way. Nobody, it's really difficult for anybody, and I don't blame them to actually fathom that. First of all, the body heals itself. You just needs a little bit of a guidance, right? And then the solemn fact that my average patient is asking, so how many treatments is it going to take for me to start blood out of my asshole? And I'm like, you have to understand, I'm not giving you a pill with a temporary solution. We are resetting, curing your body. I believe if you need to consistently seek modality in order to function, that modality does not work for you. What I do, what Sujok does, is actually curing the problem that you can carry on and function without intervention. Of course, with modern life, with external circumstances, with the stress being so innate to our existence, it cannot be possible without self-care. Self-care has benefit not just because it maintains you between the visits to practitioner, it also empowers you to know that you can do something about your disease or disbalance, and it gives you responsibility for yourself. There is such a thing, I'm not even talking about my patients, generally patients showing up to a doctor and just like, fix it. Fix it. I cannot do anything, fix it. And they live without any fixing or solutions, right? But if you take responsibility to take care of yourself, you're empowered, you're not helpless, you're automatically upgrading your consciousness for yourself.
So you mentioned self-care, and is this something that's changing in your world? Because, when we met, you, like me, were still treating everybody.
Yes.
But now you have been making this shift to push people into.
There's not enough time in the day there's not enough me out there to help everybody who's in need of help.
Right.
Yeah, I tried and I pushed and I pushed and I pushed, and I'm following your footsteps. You can work yourself to the ground trying to help.
And I've watched you do it too.
Yes, absolutely. Yeah. It's just like, and we're so stubborn until we completely break down. We're just like, no, I can do it. I'm just going to have another extra cup of coffee. it's okay. I can take, patient number 25 today.
Yeah.
Right?
Yeah.
I'm very certain and stern in my positioning that patient need to start taking responsibility to take care of themselves. But there's another thing. It's easy to be like, you're responsible for, like, what are they supposed to do?
Yeah.
So they're given tools now. There are tools for the proper self-care. And it's not just supplements. It's not just meditate and write in your journal. What is that going to do?
Yeah.
My daddy used to rape me. Well, then what? Burn it to the wind?
Right.
Right? It's tools that are effective, not just treating the symptom, the core energetic disbalance that is causing that symptom.
Well, I guess where we meet is that we're saying it's in the body.
It's in the body.
And if it's in the body, it's in this field of energy around us. So if it's in the body, it's in the field. If it's in the field, it's in the body. And I would say that meeting you at the time that I did, coming out of the clinic, you were strictly working at the field and moving stuff into the body, and I was moving at the body, moving it out to the field.
You actually made sense for me personally how what I do actually works. Because it was until I have met you, until we dove deep into your work and then my work, I didn't have understanding. I just knew it worked. I didn't know how. I remember the day when 5 years ago, we were writing definition of fascia, and you wrote out figurines with 3 different markers, zones. And I'm like, oh my God. This is what professor who developed Sujok, this is his zones. This is 3 different zones.
I'm going to bring this in. I wasn't actually going to bring this in, but I think it's important because we wrote something together as a team of us. It was Jason, Cynthia, myself, Dan, yourself. And we wrote a definition of fascia because we were trying to help explain how this field got into the body and how the body got into the field, right?
And I know you got a definition of fascia out of it. For me, I think selfishly, I got so much more than you did because it actually made sense to me how Sujok works. It is all fascia. It is all fascia. Why is it you can access any point of the body through the hand? Nobody could ever answer that. And then I saw you doing a little tweak on someone's shoulder and their, right eyeball stopped falling out. Whatever, right? And the bladder releases and the tailbone grows back. You can literally access any point of the body from any point of the body. It's easy for the hand because it's actually like a map of the body.
So we never really published this, but we sat down trying to explain the mechanism of how this works. Mm-hmm. I don't know if you've even read it since then.
You read it to me. It was long and boring.
What we used to think of as a simple, benign connective tissue, we now see fascia as a living web of structural hydraulic tubes that creates vital synergy for the entire body. Over 1,000 times more nerve cells in the human brain, this living web transmits, receives, and stores metabolic, environmental, emotional, and perceptual signals that dramatically influence our overall movement and function. We have found that treating muscles or manipulating joints to restore pain-free full range of motion is a defunct practice and has ignored the importance of fascia and how it connects the entire body. We believe that restoring the fascia allows every other system in the body to work optimally. And we go on and we talk about how to work with fascia, and we talk about the art of working with fascia involves the gentle coaxing of fascia using slow, precise directional movements. This prevents the engagement of the musculoskeletal structural defense system. We named it the MSDS. Since the body moves through regulation and redistribution of internal pressure, observing the motion of the body through walking helps us understand which zones are missing. And this is a long definition.
Spiral.
There's a spiral.
You're not talking about the spiral. That's what gets me every time. Because the only other time I heard about spiral and there is energetic pathways, there is energy sectors of the body is Sujok. So as soon as I, your definition of fascia moving in spiral, I'm just like, yeah, it's the same thing. It is the same thing. Fascia is this membrane of ethereal. Can I say that? In my world, it's native world, right? It's the field. and the physical tissue of the body. That's that membrane that connects it. You work with more of a physical manifestation of it, and I work with energetic manifestation. It's the same thing.
It is. That's where it started to connect for me, because I was trying to understand fascia at a different level. And part of the understanding...
I will be forever grateful for you, because your definition of fascia, your understanding of how human body works, explained not just the physical application of Sujok, but also the energies behind it, right? Because it has 4 energies. It has the almost like yin and yang, Goma Getara, that has NATO energy, which is balance and perfection, that has like ethereal NATO. What is NATO? Oh, it's the null world, it's point of non-existence. It's also the other, what is NATO? NATO is the field.
Right.
And you have proved it to me over and over again. When I experimented on finding fascia formula through Sujok, through the needles, I know how many times I have poked you, how many different formulas I tried on you, and not just, poking in the dark. I would do the calculations, I'm figuring out the connection, and it would be like, for me, I thought it was the longer the formula, the better. The formula fell on the predominant finger where NATO energy flows. We have NATO, Goma, Netra, Getara.
So for people who are watching or listening to this, we're talking about your primary method of treatment initially, not today, but initially was putting needles only in the hand. And you could get to any point in the body, any organ or any emotion.
What do you mean initially, not today?
Well, because you work distally and you work with your hands.
Oh, right, yeah, you're right. The hand is just convenient because it's easy to project, yeah.
Yeah,
okay.
But you basically work on any emotion or any trauma, and you work on the hand and you do math.
I do math. Well, there is not a single thing that you cannot do with Sujok. What do you mean emotional trauma? It's like a fraction of what you can do. You can, again, any organ, any layer of the organ. I can be in your retina, in your eyeball, if I want to manipulate 6 different energies within it. Any functionality. And also the calculation is actually done when I can do into the events of your life. So I know it's so out there, but it works. I calculate the internal energy matrix for the patient and then external energy matrix.
These are math formulas.
It's a math formula. It's not something I'm sitting there like, I feel like I'm going to poke a needle here and something will happen. No, this is mathematical equation. And then you go into the date of the event, into energy matrix of that event, car accident, surgery gone wrong, emergency C-section, sexual assault, loss of your son, loss of your, finding out your husband is cheating on you. You can go into the event and you can reverse, zap that energy, that trauma,
it's that
feeling
you had during the trauma that gets stuck.
You can go straight into emotion. I do add the emotions that you felt into the formula, removing that emotion that you felt, like shock, sadness, fear, grief, jealousy, whatever it is, right? But I also zap that whole abstraction of the energetic field for that day that is stuck in there. So that's why I even mentioned the 4 energies, right? So usually if you're stuck, you remove the energy of Goma, and then you remove it, and you boost the opposing energy of Gomo is like Yang, but it's simplifying it. And then you boost the opposing energy, which is expansion, like, okay, let's move forward, let's get that flow going again, which is Getara, which is Yang. But again, it's simplifying it. Then you always balance Netra, which is the energy of balance, perfection, and equilibrium. And then guess what you do with Neta? You just anchor in the Neta. You anchor in the field.
In the field. So you're anchoring all these.
Anchor in the field.
So basically, what you're saying is there's this flow of energy through the body, and when it gets stuck, it causes an emotional set. And that emotional set is that what people walk around with this shame or guilt or fear.
Yeah.
And then
attracting those scenarios over and over and over again.
To help them. So that's why these scenarios that people keep re-attracting, like they keep attracting the same partner,
Yeah.
the same situation,
Yeah.
the same work situation.
Yeah.
And, I'm going through these, even myself, just this last couple of weeks, attracting some of the same old energies.
Yeah. If field doesn't know any better, you perceive it as a negative emotion. Field is looking at it as just a vibration within itself, right? So if it's sadness, it's going to keep on attracting. Okay, let me reinforce that, I do exist. This is the sadness within the field, so I'm going to be attracting these scenarios to reinforce my certain vibration. Does it make sense?
Yeah, yeah. So the way I would explain it in my own personal life is that that unknowingly, underneath these core emotions of anger, happiness, joy that I had that are out there, sometimes a little fear, there was these core emotions like shame and guilt. And that shame and guilt was, I thought I was dealing with anger and sadness, but really at the core of it was shame and guilt. That shame and guilt was bringing all these situations into my life to make me feel shame again, whether it was not doing something or doing something wrong, saying something wrong, or
Not saying anything at all.
yeah.
Right.
And then
The core is shame and guilt.
yeah.
If you look at my map of emotions, there's one branch of where emotions that cause the most obstruction, actually the only emotions that cause obstruction in energetic field in your fascia, if you in your energy field. When I say energy field, we can actually substitute it with fascia.
fascia, sure,
So
fascia.
so everybody, when I say potato, it's the same thing. So that branch with sadness, fear, jealousy, hatred, rage, anxiety, unease. Guess which emotion at the very core of it? Shame and guilt.
Shame
The
and
same
guilt.
formula, it's the same energy, it's the same vibration. Shame/guilt. That's how I write it down in my intake forms.
So
If I were to remove that emotion for 100% of my patients, that's almost doing it 90% of work.
So a lot of people are going into practitioners and dealing with those surface emotions, but they're not dealing with the actual core of it. And shame is just insidious. It's something that we've been talking about a lot lately. The way that shame is distributed through society, and it's used to control people. And at the core of it, shame is even distributed in games we play as a kid. Like one of them is to regulate people. We've taught our children these ways of being in society. Like if you don't do this, shame on you. Shame on them. And then furthermore, we play games like tag. Tag is, you're it, that's shame on you. And I'm going to run away from you. And you're going to try and pass that shame around.
We programmed with shame from day zero.
Yeah.
How dare you behave like that? Your mother works too hard.
Yeah.
Shame on you getting this bad grade. Your
Yeah.
dad will be so disappointed.
And it's like, it's woven into every part of our culture.
Every part.
Even if you get a credit score. It's like if you get a bad mark, it's like, oh, there's shame on me for that. If you get a ticket, there's shame on me for that.
Pretty much everything is a gradient. How shame should you be feeling about yourself? And it's very seldom like, oh, you're doing great. It's actually like it's the spectrum. How shameful should I be feeling about myself today?
Right. And then we pump that into media,
Yeah.
social media, the way we
Yeah.
look and dress. And
Where we look and dress and act and how much we get paid and who we're laying in bed with and who we friends with, right?
yeah, well, I mean, our friendship,
Oh, yes.
we've definitely
Yes.
been pushing the boundaries of what society thinks is okay.
Think about it. Why is it even a question? Why is it even a question?
Well, I think we have to set the framework. I mean, we're best friends.
We're best friends.
And people would often think that
There is something more going on.
everybody.
Everybody. Yeah. And for me, I would like to point out, it's only a question just because society is programmed to perceive females' value in men's life only through sex. Innately, this is what it diluted into. And it's perceived this way by men and women. There is what she can possibly give him if not sex.
Isn't that crazy?
Isn't that insane? think about it and try to argue with me on
Not
that.
that you're a scientist, an
It
engineer,
doesn't matter
and a
if
doctor.
she's an engineer or a doctor or both.
Which you are.
Both, right? He must just want to have sex with her. What else? What other value she can possibly bring into his life? How is that perception, not just by men, but by women as well?
Yeah.
And it is such a core belief. I'm inviting everyone to sit down and honestly ask yourself. And I'm not just pointing fingers at men, I'm pointing fingers at women too. We are fighting for equality. We're fighting for, women, recognition of a female. But you're sitting out there and you're the one still judging a relationship between a man and a woman from this standpoint of, he must just want to have sex with her. I really want to swear right now. You can cut it out. Yeah, it's only he must just want to f her.
Yeah.
Yeah. Because what else? What other interests he can possibly have?
Right. And that the diminishing factor is always on the woman too.
Always on a woman.
It's like
he can be a mentor. He can be whatever, but it's always on a woman.
Yeah, it's like the only value she has in the relationship is the ability to provide sex, and if it's a friendship and it's too close.
If it's too close, if it's too comfortable, if it's no judgment, if it's just accepting each other for what it is, and there is actually no, if it's a big, look at that. I understand why it's really such a tough nut to swallow for people around us, because they can see that it's non-transactional.
Yeah.
We truly don't need anything from each other but each other.
Yeah. And that's
right.
That's
and then
part of it.
so they're like, okay, what's the transaction here? What is the exchange? Nothing. We're just friends.
Yeah.
You make me happy, I make you happy. I trust you, you trust me. I mean, besides the fact that I don't let anybody else treat me but you. But you're never in the same proximity. I see you, couple times a year? Yeah. So.
Well, but at the core of it, I think that we're talking about this because the elements of our relationship also trigger the elements of shame and societal beliefs. Mm-hmm. And this is a tough one because it is baked into every part of our culture. It's baked into movies. It's baked into what men and women think value is. Mm-hmm. And this is what I believe I want to talk about this today because I believe this is where we can start to make a change.
Yes. It's necessary. It's necessary. And girlies, you can't be marching around there saying that, we're girl power and etc. if you are still operating and judging other women based on this sexist, objectifying beliefs. I'm shaming you for that.
Isn't it crazy? It's crazy how that works.
Yeah.
In the middle of all these great conversations, sometimes you still need to take a minute to stop and breathe. Let's do that together. We're going to breathe 3 times through the mouth and 3 times through the nose. This is going to activate and rebalance your parasympathetic nervous system so you can absorb more. Breathe in with me through your mouth. 2. 3. Now 3 breaths through the nose. 2. 3. Now with that simple 6-breath reset, you can go back and enjoy more content. So taking a look at this, because we've talked about being able to treat people from the field in the body. We've talked about the belief systems around it, the core of it. They have these root emotions, shame and guilt. If we, from a self-care perspective, how can someone help to remove shame and guilt from themselves?
Well, do we have another 5 hours?
What are simple things that people that you found in
manipulation of the energy flow of the meridian pertaining to that emotion,
which is
it's more like a root chakra. So we can do forgot to tell you, with magnets. It's not just magnets on the TCM meridians, traditional Chinese medicine meridians, but it's also Sujok accepts chakras, and then so I can manipulate the flow of the chakra with the magnet as well. Little thing I forgot to tell you.
But part of this is that you've been working on a way that people can simply do this themselves. Because,
oh, that's what you're asking. Yeah, it's very simple.
Yeah.
It's straightforward. You know, with needlework, you do need intention of the practitioner behind it, right? So if you were to do the same formula with Garry Lineham, energetic Godzilla out there, with your energy field, like you still, if you don't understand exactly what you're doing, you have the same insertion of the needle, the same angle, the same pattern and sequence of insertion of the needles, it's actually going to do nothing because it takes a clear understanding. It's your intention. It's your field. Need to be clear on what you want to do for the field, for the patient in front of you. Magnets, I call them stupid because they actually have the charge in themselves. So It doesn't matter the intention as long as you place it in the right spot.
These are little magnets that you can place on your hands.
On your hands. There's
and
12 meridians.
You can do it yourself.
You definitely can do it yourself. And it's super simple. You'd be like, I have a migraine for the last 20 years of my life. Okay, so put it on point 810, for example. Boom, migraine is gone.
Right away. Like literally.
Within 4 minutes, patients showing up, splitting migraines. I like actually treating people they're already coming in with a flare up of the symptom. Like I'm using migraine as one of many examples. You put the magnet, within 4 minutes, I can breathe again.
Well, we saw that happen here just last night.
Yeah, but the people that work with you are, I believe, they're in a higher vibration just because they are with you, and so the girlies were able to experience it immediately. Like
within minutes,
seconds.
Yeah.
Seconds.
Yeah.
But average person, within 4 minutes it imprints, I can tell. Like, I mean, I've been doing this forever, like 500 million years. You put the magnet on, within 4 minutes and imprints, you hold it for another hour, and it's not just treating the symptom, it is curing the cause.
So you're coming out with, like, this is something that you're coming out with as a self-care program that people can do themselves.
Yeah. So think about like brushing your teeth between the dentist appointments, and actually your appointment with the practitioner is going to be so much more effective, so much faster, and they'll be able to grasp on the stuff that if they don't need to be digging for the pile of garbage in you that you're already taking out the garbage on a regular basis, they can go and grab the stuff in the dusty corners that haven't been touched before, and then you will come out spanking clean.
That's one way that you can take self-care to the next level.
Yes.
The reason, at first, I wanted to prove that everything is done in the body, and technically it is, but the energy flow through the body with all of the stimulation that we have going on around us sometimes can just be, it could be literally Wi-Fi, EMF, chemicals, people around us, signals around us that are constantly disrupting.
Car exhaust.
Everything.
The food, everything. But you're just so funny. I had a thought. You're like, everything is done for the body. Still it is. Yeah, I cannot hang a magnet on the cloud that's floating around you.
Well, the body is the interface. The body is our interface. It's the best interface to the field. You can interface the field different ways, but the body is the direct route in. It's like the hardwire in instead of the Wi-Fi.
And this is the keyboard.
And this is the keyboard.
Hand is a keyboard. It's like, if you look at it, it's very...
10 fingers, 10 organs, fascia in your skin.
So you're going into 5-element system, which is TCM. It's actually 6 elements. I understand that brain and spine is not an organ, but it is part of the elements. So we're not...
So that's a good question. Is this like, because a lot of people say this is like TCM.
It's not like TCM. TCM is a fraction of it.
Yeah.
TCM was like, look at this room with all the furnishings and everything. TCM was that couch.
Yeah.
Sujok is the whole room with us sitting in it.
So can a practitioner that is an acupuncturist, because that's technically what you are, you're a doctor of Chinese medicine, you're an acupuncturist, and then Sujok was a way that you were able to express your care and healing with people. You were able to do that through this modality.
It all started with Sujok. I had no interest in medicine whatsoever. I was a nerd that was obsessing over linear algebra. I was in chemical engineering, zero interest in medicine whatsoever. And then Sujok found me. Long story short, not going to even get into it. Then I went into TCM and spazzed out, and I did all 5 years and got DR in front of my name, which was so unnecessary. I could have just stopped after 3 years, got my licenses in acupuncturist, and that's it. But yeah, officially I'm a doctor of Chinese medicine, but I don't like being called a doctor. So I do believe that TCM, understanding of the human body, is correct. I agree with it 100%. I do believe that my ability to execute unthinkable with Sujok is because I do have because of the 5 years of schooling that I went in TCM. Right?
So I've worked with a lot of practitioners, obviously, and a lot of Chinese medicine doctors. But the reason why I personally went to you, and the reason why I still let you work with me today, I still
ask you to
help me when I need it, is
3 o'clock in the morning in Dubai.
And you do it remotely, which is great. But the idea was, as I watched you putting needles into the hand of other people, but you were talking in Russian. I didn't understand what you were saying, but I could feel the intent behind what you're saying.
It's intention behind each and every.
What are you saying?
What I'm doing to it. Okay, so I'm gonna go into the, body joint and open the layered system of the body, go into the organs to goma branch, goma layer. Then I'm going into the thymus there, whatever, and then reducing Getter, tonifying goma. So it's a sequence, right?
But you're talking all the time.
It does not always. I
In
either
your
talk
head
at
you
home,
are.
and absolutely. Because when I'm working, nothing else exists. The whole universe can be burning down, but I am in the patient with a clear intention and understanding. I'm seeing exactly what I'm doing. It's like I'm opening this door and that door and this door. I got to that spleen.
That's how I work too. I see when I'm dealing with spleen or I see the organ, I see the flow.
For you, I believe you go straight, like you go just, I'm going to go into the spleen. For me, I still like I'm using that map. I'm just like, now I'm in the functional layers of the body. I opened this door, and now I'm going into the reproductive system. Poof, now we're opening up another 4 doors. I'm going to go into the testicles. Now I have another 2 doors. What am I going to do with his balls?
So people that come, like, in this and what you're doing, sometimes people being 10, 15, 20 years in disease and treatment, and within a matter of literal sessions, what are some of the most common things women or people come to you for right now?
There's no such thing.
What are the big ones?
I get that question, but everything is big. Like autoimmune, mental health, reproductive issues, infertility. It's freaking
But you're known
pandemic.
You're known for fertility.
Yeah, which is wild, because I don't even like babies. I just get everybody pregnant. Fertility is such a thing nowadays because they put girls on birth control age 14. They're not even sexually active, right? So they put them on hormones for, to manage acne or pimples or whatever. Now women, we decide not to reproduce until mid-30s. So when you put it's over 10 years of being on birth control, so your ovaries are shut down. And then what's next? It's IVF, unexplained infertility. So, and then this diagnosis, PCOS, and they freak out women so much. They come and just like, oh my God, I have PCOS. I'm like, so? Like, okay, cool, you're going to get pregnant in a few sessions.
These are very easy issues for you to deal with.
Easy issues, and it's not an issue. And endometriosis.
All the testimonials of people coming in and out of your clinic is just, they think you're magic, but the truth is you're actually...
I just know what I'm doing, and because I have ability to treat it. Right? And so I have friends who are medical doctors, and they ask me, like, Alla, how do you deal with listening all the stories that people coming in? I'm like, because I know I can do something about it. Right. Yes, I can hear or listen about this mountain of pain sitting in front of me, horrendous stories, horrible circumstances, and these unexplained illnesses and disease with no cure but strong painkillers prescribed to them. and nothing else, antidepressants and painkillers, and they say like there's not like we can't even do a surgery on you, and I don't flinch because I'm like, okay, I can fix it because I know this is the end for that person. Like this is the end of that pain and the suffering, because there is a solution to it.
That's where you and I actually came together, is because Human Garage itself, when people would come into Human Garage, it was because they tried everything else, and they came traditionally from traditional systems, and we were able to move them past. And what I was attracted to in what you did or what you do is that I always thought it was emotional, but I was still laden in the physical symptoms and pushing through the physical issues and the movement issues to get them back, and then their emotional state would change. But you actually go right to the emotional state and change the emotional state, and then as a result, they move differently, they function differently, their relationships are different. And that's what happens. Like literally that is the end result of what happens when patients come to you.
Instead of treating the symptom or physiological manifestation of the disbalance, aka eliminating one floor at a time, I collapse the basement of the building. And then the whole thing collapses.
The whole thing collapses.
Yeah. There's so much I want to tell you.
What do you think about, so what about it's very clear that you can do what you're doing.
I can do what I'm doing.
that you're successful. People come to you for that reason.
Yeah.
Like there are lineups.
They're not seeking Sujok. Nobody knows about Sujok. They know there's this chick that fixes everything. That's
Right.
how people know me.
So there's no doubt that you can do this. And you also see that the future of medicine or care is not only practitioner driven. How do people, or where do you see people empowering themselves? Like what does it look like in, let's say, 5 years?
Self-care.
So what does that look like for people?
Be given tools that actually work and clear direction, and helping people to understand their body the way you and I see it. It's actually not complex. It's pretty simple, right? It's just, and then giving the simple tools ability to work with their own body. There's so many modalities out there that make it look so complex with the fancy words. The Western
complex
medicine, the Eastern medicine, all this diagnosis, and we need to do the droplet of the drug and eye, and then the this tincture and that tincture. But this is wrong, and they make it look so intimidating, right? And I think it's part of the medical modalities way of differentiating themselves and actually showing to the average patient, hey, I'm better than you because I use this fancy word and stuff. But human body is simple, and the way to heal yourself is simple. We are trained, and the society and the medical modalities out there reinforce the complexity of it. But what actually works at its core, fascia maneuvers, Sujok, magnet therapy, for example. There's got to be a third one too. I like things in three, but we'll find it.
Well, I feel that it's the self-care. I mean, even the magnets that you give my team all the time to put on their hands and you explain to them how to work through things, they feel differently automatically. And that is, technically, it's a self-care modality.
Yeah.
And if you take the magnets and apply it yourself, you take fascial maneuvers, move that energy through the body and the structure, and then using focused work with a practitioner.
Yeah, focused work with the practitioner. The practitioner actually knows what the they're doing.
Yeah.
I have patients showing up, I have OCD, and then so like a mother, last week it happened, brought a 16-year-old boy. I'm not kidding. The printout of the OCD diagnosis with all different tests was this thick, A4 format.
So who is the OCD, the boy or the mother?
No, well, okay, well, that's a different story. I'm talking about the person who slapped that book into mother's lap, saying like, this is what I find about your son. These are my findings. Very complex, overanalyzed, different. Like, how can you write a book about OCD? You know what took me for the kid to stop counting the panels on my wall? 25 minutes.
And what'd you do?
2 magnets. When I throw in needles as well too.
So that's it's as simple as that. Like somebody who has a lifelong condition that's being diagnosed by a system,
Energetic
you
response.
can change the energetic response.
I mean, I don't want to sound like I'm bashing all the medical practitioners, but kind of am. Like, you sitting out there with your fancy degrees and you put fancy diagnosis on a patient with zero solution.
What is a diagnosis then?
It's a label.
Yeah, is it?
And it's actually a label that inflicts an element of shame. Oh, this is my burden. I'm going to walk around with this backpack.
There we go. Now we're back to that issue. It's really about shame.
You really cannot do it because you have ADD. You shouldn't be doing this. Or you are schizophrenic. Oh, like you can't function. Like, oh, this is it. This is my cloak. This is my clock of shame. And this is the limits of
the label.
The
label is shame.
And the limit of what I'm not allowed to overstep.
So we got shame in our schools. We got shame in our relationships. We got shame with our
conditions.
We got shame in what a doctor gives us, and it's all meant to control.
Yes. So one step at a time. Is it too cocky to say? But we are giving people the opportunity, freedom from the medical diagnosis, freedom from the shame that was inflicted on them because they were giving a condition and diagnosis and no ability to
I would say that's
defeat
accurate.
it.
I would say that's accurate because
it's one of
what
the
people I'll speak for myself. I had concussions, I had pain, I had brain disorders, brain fog, digestive disorders, and I felt like all those things were my body was wrong. And because my body was wrong, I was wrong for it. And that was a big part of my journey was something's not working with my body. If I get sick, if I was like, I had a fever or flu or coughing, I'd be like, I'll be back up in a day. Because it was like...
Got to push through.
I was like I was a deathly fear of something being wrong with my body.
Yeah.
And if there was, and I wasn't through it soon, then I wasn't healing right. And if I wasn't healing right, there was shame again. We're back down to the same core issue.
Yeah. So what did we have? We distilled into societal shame, work shame, medical diagnosis shame, and what else was the fourth one? Was it just 3? So at least we're providing the solution for
media, what we're told that we should be.
Everything.
Yeah.
Absolutely everything laced with shame.
And
really powerful way to control human.
Well, that's what we're doing, and what we're doing is we're breaking through. But it was interesting because at the core of this whole discussion, we got to this part of it because we were talking about our relationship and friendship, and how people wanted to illustrate shame on us and make it into whatever they thought it was.
Whatever makes them comfortable.
Whatever makes them comfortable, or uncomfortable, which is familiar.
Which is familiar, which is comfortable.
I see a world where we have relationships with people regardless, because we want to, because they add value in our life, and there is no catches, or there's no
transaction.
There's no transaction.
Yeah.
It's just there because I want to.
Just because.
Now, do you think if we started with that a lot of the diseases that we have would start to go away?
Yeah, it would eliminate a huge amount of shame, right? Because at the end of the day, we are relationships. Right? With everything is that's how we evaluate ourselves, is through relationships, right? We're looking at, we don't see ourselves, but the people in our lives are our mirrors, right?
And those mirrors are mirroring
and
shame.
if that mirror is laced with shame,
right, we can jump off a big boat and help people. First of all, I don't
want to jump off the boat anymore. I want people to start building their own boats.
Yeah, and we're doing that. We're giving them tools, self-care tools, fascial maneuvers. We're giving them community, which is community that has acceptance, which is big.
And understanding of yourself, of who you are, and what is human, and what is the human experience. Giving them the comprehensive guide to human existence.
To human existence, which
there's got to be a book.
Yeah.
Comprehensive guide to human existence.
Well, I mean, that's what that's what we're doing, and I spend a lot of my time with you talking about that. Most of the time we spend talking is literally about this stuff, which
It is about everything.
it's about how the body works, how energy works, how relationships
Crossing
work.
the street in New York, thymus, T cells.
Yeah, we were talking about thymus.
Thymus, literally
I said
in the
my
middle of
direction-
intersection.
My direction is getting really good. It's my
And I'm just
thymus
like, what's the
going.
correlation with the gallbladder? And wait a second, thymus. Oh, okay, so it's actually the same. It's the same shape as lung, and yes, lung is under the same element that controls the immune system, and T cells is where the thymus, like blah blah blah. I'm like, oh my god, epiphany.
Those are all of our conversations.
It's all, and just like it's one hook. You say something, or I say something, and it goes. It starts with, look at the hot dog stand, and then it finishes in thymus.
You know, most of the people that are watching this or listening to this will never get the chance to experience you directly. This is part of why I've been encouraging you for all these years, to bring this magic to people in a self-care way. Now, if you come to me, I can help move your body in 30 to 40 minutes would take you 1.5 to 2 years to do. Just like if somebody comes to you, you can move right to the core issue. But you're now creating a system, which will be out soon, of magnets that people can place on themselves, which dramatically change their ability to have the way that they feel and perceive their environment right away. And that'll be something that people can start self-caring. And that's one step past the movement, one step past the diet and the nutrition and stuff like that. That's the one step to rebalance themselves. And I'm excited for when that comes out. And that's going to be soon. And I'm telling everybody it is going to be soon, so it will be.
Pinky promise.
Pinky promise. But today, I think it's important for people to know that you got here through this unbelievable therapy called Sujok.
Yes.
So describe what Sujok is.
It's a comprehensive philosophy of life, I would say. Sujok is...
It's not just needles and hands.
It's not.
Because they have a movement process.
It is absolutely, right? And then actually, so movement process kind of reminds me of the fascial maneuvers a little bit, and then Qigong at the same time. Sujok is a life science that combines elements of Eastern and Western medicine, physical theory, metaphysics, Taoist principles, all in a system. Sujok is this one system that got everything that's true
and put it all together. It's kind of like the human garage.
Everything that's true and accurate, and put it together.
Yeah. I mean, that's what we did in the clinic, and that's why this works. And there are Sujok therapists starting around the world. You are running Sujok in Canada.
Yes.
And
there's going to be the first seminar ever, end of September, in North America.
Yeah. And you're bringing this to doctors or acupuncturists or basically acupuncturists right now.
Yeah, I like my TCM peeps because they do have a proper understanding of the human body. Essentially, anybody who is licensed to needle a human being in North America, they can. But TCM, they will just get it right away because it's from 5 element, there is a 6 element. And I mean, anybody who had critical thinking during TCM school, they had asked the question, then why are you not talking about pericardium and Sanjiao? Why is it this another pair that is not assigned its own element, is just somehow adjacent to the element with heart and small intestine? And then the teacher would, don't question the tradition. It's a tradition, right? So I know
traditional Chinese
medicine, right? So yeah, TCM people, shame, how dare you? I love my TCM people, and they absolutely, their view of human body and functionality is on point.
So because of the way that you've gone through your journey, your personal journey, which we haven't talked a lot about here today, and we haven't talked but we will. Yeah, this is because I want people to know more about who you are.
So I'm Russian, even though I don't look Russian.
Okay, so I guess I want people to have a better understanding because of who you are and how you got here, because that
we talked about not to tell the old story anymore. I'm just on the brink of actually shedding any other stories and definitive factors that I would be answering this question with. I'm literally breaking off that as of 2 weeks ago, and now you're bringing this up. I don't want to. Who am I? Yes, well, I'm Canadian with Russian blood running through me. I have a lot of education, way more than I need to, which I don't even use that much. I am a big fan of critical thinking and actually acquisitive approach to the theory that is given. The way I work, but why my protocols in Sujok actually work is because I don't follow the protocol. I actually like all my findings, I see what actually works on people, and I treat the cause. We spoke about it. A lot of Sujok practitioners out there, because Sujok gives you a tool to access any part of the body, right? So if they have, for example, problem with Crohn's, they might go straight into the colon and work on the energies of the colon. Again, that's treating the symptom. Mm-hmm. It is one hop step away from Western medicine. It's treating the symptom. You need to treat the root cause. So I am a non-ordinary Sujok practitioner with outstanding results because I do not listen to people when they tell me what to do something.
So
I question that.
I like what you said, because I'm doing the same thing. There's no need to tell the old story. It's telling the story of who you are today.
I mean, well, now I made such a big fuss about it. They'll be like, what is her story? Was she a hooker? Like, maybe. Just kidding. What's the story? I am a Gemini. I like a real Gemini, Grandmaster Gemini. I bounce from one profession to another, from Bachelor of Commerce to makeup artist to owner of medical spa to chemical engineering to, TCM med school, right? So, and then there's different, and then I found myself. The itself found me. The Sujok found me. I remember the first day I was treated with Sujok because, do I even say that? It's still old story. Like I was depressed.
Sure.
I was depressed. And then I flew back home to Russia and I was treated with Sujok by, she was top 3 Sujok practitioners in the world. Completely fixed me within 12 days, whether before that I tried, I'm not a victim, I tried everything, from medication to meditation to the retreats, working out twice a day, the diet, and nothing was working. And she said that this is my calling. And she's like, you need to be doing this. And I said, I have zero interest in that, zero interest. I do not like this stuff. I don't want to. And she held mini course, like, let me try to teach you a mini course in the Russian government hospital. Besides me, there was couple doctors, a nurse, one surgeon. It was like a mini course, and I remembered that. So Sujok was like a remembering. It was before and after. My whole life just went from before to after, just separated from before to after.
Yeah, I think that's a good way to tell your story, because there are some things that led you to it, which are okay. You don't have to live in all of the story.
Yeah. I guess if you're not actively seeking, right, which I wasn't, Sujok, then you have to explain why it even was introduced into my life, right? So.
Yeah.
Yeah.
Yeah, and it is crazy, all the things that you've done.
ADD much?
But they made you who you are. You have this incredible innate. This is why I love talking with you and sparring and energetically talking, because we can take conversations from engineering to medicine to emotions, all the way through to metaphysics and
philosophy of existence.
Yeah, and that's where a lot of our conversations and the sparring of those conversations are what helped me think of the body another way.
Any other topics are boring. What else is there to talk about? That's why I say, if I don't talk to you, my brain dies. I need our conversations like an oxygen or hydrogen nowadays to my brain, to my mind. Yeah. What else is there to talk about?
Yeah, but that's the part. I want the world to know who I spend my time talking to sharpen my tools when I think of the body. And you've always been able to help me focus, my direction. You've always been able to help me see things from another way. And it's because we're looking at the body technically the same, looking at the human experience the same. We're just looking at it from different angles. And that narrowing in of that focus has allowed me to see things differently.
You know what I just realized? I don't think I ever truly disagreed with you and vice versa. And my innate programming is actually disagreeing and confrontation. You're going to tell me something is that, I'm going to first question that. And I have a tendency to say no before I say yes. So that's what I'm saying. Like, we're truly viewing a human existence and the energies and everything in the same way, even though completely different.
Well, that the other part too is that I believe so much in this energetic pairing and this work that we attract people into our lives to help us. And it's our job to recognize who we attract into our lives. Even going to the store today, the girl at the counter, she had one of her placements occur. She was 28 degrees Pisces, which is my wound.
Right.
And her father was my birthday.
Right.
And then somebody stopped me on the street coming back, says, "Hey, I love you guys." And she was the same birthday as my son. And it was like all of these things happening. And then I got on a news with British media, and the lady interviewing me was also another Pisces. So 5 Pisces today, and I'm like, that's not a coincidence. There has to be some reason why this is happening.
And we're in a Capricorn day today, right? So
Karma. Yeah.
Yeah.
Listen, I want to thank you for coming all the way to New York to hang out.
Thank you for inviting me.
And have this conversation. I know it's the start of many, and I know that because of this conversation, you're kind of coming out of your closet because you've been in Vancouver sheltered and people can't even see you there. But you're taking the next step, which is to share this gift that you have at a worldwide stage with practitioners all over the world. And I'm really excited to be a part of that.
I'm so excited. Thank you for having me. It was fun.
It's fun.
Way less scary than I thought.
Thanks for tuning in. And if you enjoyed this content, follow us on social media channels, The Human Garage Experience, Apple, Spotify, and all other channels. We're on a mission to inspire 1 billion people worldwide, and the way that you participate is by liking, subscribing, and sharing our content. Every share that you take brings us one step closer to that billion people. This has been a fantastic episode. We enjoyed presenting it to you. Be a part of this worldwide revolution and share it now.